Good day, Blaine. How are you?
Very well, sir. Thank you very much indeed for coming through and helping us, I guess, navigate through so much misinformation out there that is causing panic and is causing fear. I want to start off with where we left off, I guess, during this week when we had you on the program, talking about the use of masks. And we see more and more people using masks, even, if they aren't near any people, the mask is on. I saw, for instance, somebody running the other day with a mask on. So scientists, Doc, are telling us that the virus doesn't linger in the air like say, for instance, measles, for example. How long does it stay in the air?
So, Blaine, this is a virus that, as far as we understand it, and it's important to point out that it's a very new virus. So we don't know as much as we would like to know, and of course, more data will come up in the future that scientists will study and then we make available. But what we know is that it doesn't typically spread through aerosols. So it's mainly spread through droplets. So it does not spread through the normal means like a measles virus where it's an airborne virus. It's droplet spread. So as I explained last time, it's important that it's the droplets that come out of the mouth as we speak, through saliva, through sneezing, through coughing. Those droplets, the saliva droplets or cough or sputum, that's what contains the virus. So it typically does not transmit through the air as a normal or as typical of measles and similar viruses.
Right. So the WHO tells us that about 80% of people who, contract COVID-19 will recover well. There are a few people that will need hospitalization. If you are hospitalized, what's the length of an average stay, would you say?
So it's a very difficult question to answer. It will depend on the nature of the severity and what other comorbidities the patient may present with. So let me just explain that a little bit. So the average person the 80% that you're talking about, is a person who's otherwise well, has no other known illnesses, and they typically do very well even with basic supportive side of a hospital environment. So what typically complicates the presentation is if a person has other conflicting or coexisting diseases like lung disease, chronic lung disease. We know asthma being one of them, heart conditions, kidney conditions. So because for those patients that the virus is very severe, is that it might cause respiratory difficulties or breathing difficulties, and they need ventilatory support. They might stay, and what we saw from the Chinese data, typically between 2 to about 4 weeks, and sometimes even longer, depending on what complications that they present with. So usually it's supportive care for those complications, not primarily complications of the coronavirus itself, which causes mainly the respiratory difficulties.
So, Doc, if you are infected with COVID-19, but yet asymptomatic, how long will the virus stay in you, and when is it safe to be around other people?
So for most people, and what they're doing currently is that 2 to 14 days is the typical period to know that actually the virus you have the virus and you become symptomatic. And shortly thereafter, most people recover fully and they are no longer infectious even if they've had the virus. So that's why the guidance currently is that if you are suspecting that you have the illness or you have been exposed, isolating for 14 is the recommended period of time to be away from people. Then for most instances you should be safe again to be in public places and with other people where you are no longer infectious.
Right. A lot of South Africans rely on public transport, and we've of late heard the term called contact tracing, whereby you trace the people who are exposed to somebody that is infected with COVID-19. How easy or difficult is it, Doc, from your understanding, to trace those people, especially for those who are using public transport?
It's truly not my area of expertise, Blaine, but I can imagine it would be very difficult because tracing depends on a particular index person, they were with at what particular point in time and to what exposure or to how the contact would have been with a particular person. So I can only imagine that if you were in a public transport system like a taxi or a public bus, it's very difficult to know who was in that bus because half of the people in there you may not know. So it is going to be a challenge for the Department of Health and the NICD to be trace fully and understand who a particular subject would have been in contact with. Yeah. But what we know of this kind of illnesses is that close contact is much more important than just simple exposure. So what I mean by close contact is that if it's people I might be working in the same office with, where I spend prolonged period of time with, or people that I live at home with, that is much more important to ensure that those people. So of course it does not mean that if I'm sitting next to somebody in a taxi and I'm coughing, they are not going to get infected. But the people that are at highest risk are the ones who are close contacts for prolonged period of time. Right. That's where the risk is. But we still have to obviously be vigilant even in public spaces.
You know, you're talking about the workplace and in the office environment. And, you know, here, especially at the SABC, when somebody has a birthday, we often, share a piece of cake. We often share food as well. And, with regards to this virus in terms of food, often you're going to get people now that's staying away from going to restaurants. They might be taking, doing takeaways rather. Should they be worried about anything in terms of the virus? Talk to us about the virus and its relationship with food.
So I would treat food other surface, in fact. So we do know that actually the droplets do survive on different surfaces, as I explained in our earlier interviews this week. So as to how long it would survive on a particular food item, I'm not aware of any data that has been published yet, but I would consider that it is also a risky surface. One of the that was published, they were actually exploring cardboard surfaces. There was quite a lot of variability with the survival on cardboard. So I'm using cardboard here as being perhaps a means to package items, be it paper or case might be. So we do know that it does survive on surfaces, and we do know that it is likely to survive on food items. Again, in this instance, as what we currently are seeing as per the guidelines from the WHO, that you should practice as much caution as possible. So therefore, clean surfaces, decontaminate, and it's perhaps a safer option to stay at home and eat food that you've prepared yourself, and that you know who has been actually in contact with that food. It may very well be that actually if the food is packaged and it's transported safely, you can have an approach. And I've been seeing some reports, for instance, in close down the city, that actually they are much more reliant on fast food that is delivered via mobile. So it's perhaps actually better advice to say cautious. Prepare food at home, and only if you have no other alternative, then you rely on actually transported food, because you have no idea of the chain of contact for that particular food item that you're receiving. So it could very well be that the person bringing it to you is asymptomatic but already infected, so you don't know as you receive the parcel, and it's almost impossible to actually prevent that from that eventuality from happening. So it's again being cautious and taking rather a stringent approach to ensuring that you know the entire value chain of the contact of that food that you're receiving.
Right.